This year, there will be nearly 2 million new cancer cases diagnosed in the United States alone. But soon, there may not be a need to undergo a whole series of testing and some invasive procedures. Scientists are developing a test that would spot the disease in just 10 minutes, and you can do it at home. Fox News Medical A-Team's Dr. David Samadi joins us now with the saliva test. It doesn't cost a lot. You can do it in your own house. Doesn't hurt. But how are we detecting cancer today?
Anna, this is a very important segment because, as you mentioned, about 2 million Americans are diagnosed with cancer every year. 500,000 actually die from cancer. How do we prevent this? Today, anybody can have cancer and have absolutely no symptoms, and we have no idea. That cancer cell eventually starts to grow, and it's going to spill in your lymphatics, in the blood, and it goes to another organ. That's called metastasis. And that's when we would use biopsies that are invasive. We would use CAT scans, MRIs, images to find out if someone has cancer. Somebody can wake up in the morning with headache. They can get an MRI and find out they have aggressive mass, and they're basically with poor prognosis, stage 4 lung cancer, stage 4 prostate cancer. So this particular test is a game changer. It's still in the clinical trial. I think the future is absolutely bright, where we would take a drop, listen to this, a drop of saliva, and within 10 minutes we can find out if somebody has cancer, because prevention can save life. If we can catch and detect the cancer early on, we can really save millions of lives out there. This is a study that's coming from UCLA, and basically looking at the DNA and the genetic markers of the cancer in your saliva can tell us whether someone has non-small cell lung cancer and other cancers. I think it's tremendous.
Right, so it's a way to be proactive rather than reactive, too. More people are likely to get a saliva test. It's 10 minutes, doesn't cost a lot of money in their own home than they may be to go to the doctor and get screened for things. This is for lung cancer right now, is that right?
That's right. So they're looking into stomach cancer, they're looking into prostate cancer. This weekend we talked about, for example, using your urine test and look at the gas and vapor that comes from urine and detect prostate cancer. That's tremendous. Imagine men don't have to go through all those biopsies and MRI tests, etc.
And what's the future of this? I mean, could you also use the same sort of test for diagnosing diabetes, say, or neurological disorder?
That's interesting that you're asking, because they're also looking at a lot of neurologic disease, Alzheimer's, diabetes, looking at saliva. So what we're understanding is a lot of this secret code is already in saliva, is also in blood, blood biopsy, and is also in urine. It's tremendous. Today, what we're using is, for a lot of people, we're using something called PCA3 test, which is a urine test to detect prostate cancer, which is tremendous. There's also another new site that we just went up a few months ago for people who are diagnosed with prostate cancer. If you're just diagnosed with prostate cancer and you don't know what to do, you're confused, just like a 911 code, you go to prostatecancer911.code. There are operators, and we can help you for free and guide you through this. But everything's going to be posted on our social media, because I think it's a very important topic.
And hopefully this new saliva test comes out in due time and saves a lot of lives.
In the next few years, the whole scope of cancer and cancer treatment is going to change.
Yeah, game changer. Awesome. Thank you so much.